Now we're going to look at the actual application of the precordial stethoscope, how we should apply it, how we should figure out what size to place on the patient. In the neonatal patient population, the precordial chest piece should be placed on the left side, mid-clavicular, perpendicular to the sternal border, just above the nipple. As you notice, the chest piece should be put above the nipple, especially in the neonatal population. You never want to place it on the actual fragile skin of the nipple, because in your preemies and in your micropreemies and in some of your infants, that stickiness, if you take it off, you could actually pull off part of their nipple because their skin is so fragile. So you want to make sure that it's just above the nipple itself. In this slide, there are two positions possible in which you can place the precordial head. The one is the standard, which all the books show, which is the left, just a left chest above the nipple, or the alternative one would be in the left mid-axillary line perpendicular to the nipple. And the reason for that, too, you want to consider, remember the Murphy's eye. The Murphy's eye, when you're listening to breath sounds and you have the precordial stethoscope on that left chest, it's there so you listen constantly, so that you can, if you're listening and all of a sudden you hear a different in quality of breath sounds, and you know, oh, maybe I went a little endobronchial and my Murphy's eye is giving me some airflow. And the way you can confirm this, or even prevent this, is if you put it on the actual left axillary area. And in that case, when you lose breath sounds, because it's a little lower in the lung field, that you won't be catching that inadvertent Murphy's eye, which is throwing air to the left side of the lung. And you can pick up endobronchial intubation even quicker and prevent any kind of desaturation that can happen in the neonatal population. This is always important with the neonatal population because they pretty much haven't had anesthesia before. So if you're sitting there and all of a sudden your sats go down, you don't really know right away, is it cardiac? Are they having allergic reaction to anesthesia? Or is it just a simple fact that my endotracheal tube became dislodged? So it helps you prevent things a little quicker when you use the precordial at all times. Now this picture demonstrates why size matters. Each of the different precordial heads are actually labeled for you. So you can see the neonatal, infant, and pediatric size precordial chest piece. If one was to use a pediatric chest piece on a small neonatal child, and you have it on the left side, what happens is you could end up hearing breath sounds from the right side because the chest is so small. So in order to make sure that your endotracheal tube is in the correct position, it's very important to use the correct size precordial head so that you don't hear breath sounds from the opposite side coming over to your precordial stethoscope. And here's the same thing, only on an infant. And the precordial head that's on this patient is an infant-sized precordial head versus the neonate. Now here are the different precordial chest pieces on an infant. As you can tell, the neonate would probably be too small. The adult is too big because you would be able to hear breath sounds coming from the right side, which would echo into the left side. Most people don't have an infant. They may have an adult, a pediatric, and a neonate. They're a small one. So if you don't have an infant chest piece, the pediatric chest piece would probably work just as well, and you would be able to use it without having to worry about hearing breath sounds radiating from the right size. But if you had an infant size, the infant size would be probably the best one to use.